I never wanted to study medicine because I think it had something to do with, the teenage kind of rebellion. My parents are both into medical practice. So I just wanted to be different because I didn't want it to be like I was doing it because both my parents were into it.
Hello and welcome to the International Student Experience, a Swansea University podcast where we delve into the stories and journeys from students from around the world who've chosen to study here in the UK. My name is Dav Turner, I'm your host, and today I'm joined by Nenkang Sam-Mbok. Thank you for joining us today.
Yeah, thank you very much for having me.
If you just want to introduce yourself, say who you are, where you're from, and what you're studying, please.
My name is Nenkang Sam-Mbok. I'm from Nigeria, currently studying health informatics MSc. I'm a medical doctor by profession. I'm also a data scientist. I'm also the CEO and the co-founder of Rebecca Mbok Foundation, which is a non-governmental organization based in Nigeria, which is basically a foundation that works on the reduction of maternal and child mortality rates in Nigeria.
That's quite a lot there. Amazing. There's a lot that I want to ask about, but if you could just tell us what was your life like to get you to the UK?
Well, I did my primary education in Jos Plateau State. At a point I was homeschooled, and then I moved on to secondary school. It was a boarding school. It was an Anglican secondary school, St. Paul's College, Quartas. And then I moved on to Bingham University. Bingham University is a private university in Nigeria owned by a church, and I studied medicine there. I also did an intercalated BSc in physiology. Graduated medicine, and then did my internship, practiced for about 7 years. Mm-hmm. I worked with the state hospital, Plateau State Specialist Hospital, and then I worked alongside at the foundation. So what got you into medicine? When did that calling come to you? Because it seems like you've been doing it for a while now. So when did you know that was what you wanted to do? That's a very interesting question. I never wanted to study medicine because I don't know. I can't really point out and say why I didn't want to study medicine, but I think it had something to do with, the teenage kind of rebellion. My parents are both into medical practice. And so I just wanted to be different for no reason. I just didn't, not that I didn't appreciate what they were doing, not like I had a problem with, but I just felt, okay, I should do something different because I didn't want it to be like I was doing it because both my parents were into it. So I set out to become an engineer, and I was passionate about it. In fact, my classmates from secondary school till today still call me engineer. So I wanted to become an aeronautic engineer, and I was really working towards that, but my mom never really liked the idea, and she would always, whenever she was cutting my nails, she would always say, "I have the hands of a surgeon," and I would just laugh it out and forget about what she said. I was still bent on becoming an engineer. Unfortunately, she passed, a year before I finished secondary school, and after she passed on, I still, insisted on studying aeronautics. And so I wrote the exam, I went for the interview, and I got the admission and even got 50% scholarship to, study aeronautics engineering. We have just one school that offers aeronautics in Nigeria. I decided, at the last minute to change my mind, and I applied to Bingham University. And even in Bingham University, I decided I was going to study computer science. But before resuming school, I fell ill. I had typhoid, which is one of the, common illnesses we have, in Nigeria, because of the quality of water. And I fell ill with typhoid, and I was admitted in the hospital for 2 months. I almost lost my life. And during those 2 months, when I saw how the medical professionals, especially the doctors, when I saw how they went about the treatment, when I saw the level of knowledge and, the professionalism and how they went about the treatment and how they, went about it, I just admired everything about it. Till today, the doctor that treated me then is still one of my mentors, Dr. Yileng. In fact, I worked with him just before coming here. He's a surgeon in orthopedic surgery. But then he was a medical officer. He was just finishing his youth service. And he was the one that treated me. And that process was more like a defining moment in my life, because that's what made me change my mind. And it was on my sick bed that I called the university and asked if I could change to medicine. And they said, oh no, unfortunately, we have a lot of medical students. And even, they had about 150 medical students, and said, we can't give you that, but we can give you a related course like microbiology or biochemistry. So I was like, okay, fine. So I changed to microbiology. It's really interesting because my dad was not in the country at the time.
Right.
So I changed to microbiology. And when my dad returned to the country, I told him I had changed my course from computer science to microbiology. He's like, what's wrong with you? I'm paying, because it's a private university, so it's expensive. So he's like, I can't be paying this much money for you to study microbiology. And I didn't just understand why he would not let me do what I wanted to do. But of course, he saw how I was, drifting. So he was sure that I wasn't really properly informed. So he reached out to someone and randomly called the person, and the person was like, no, not microbiology. At least biochemistry is better. So I changed to biochemistry. So after changing to biochemistry, that was just in my first year. But at the end of my first year, luckily I had very good grades, and the university had a policy that year that those that had the best grades in biochemistry were going to be offered medicine, because out of the 150 students in medicine, they needed 50. But the criteria, the standards, or rather the standard they set was a little bit too high for some people to make it. So not up to 50 students made it. So for the deficit, they brought some of us from biochemistry, and that's how I got into medicine.
It's quite a journey.
Yeah, very long journey.
But it almost seems fated that was life was pushing you on that path.
Yeah, yeah.
When you finally got through the biochemistry and you got into medicine, was your dad happy then?
Yes. I was really happy, because, to be honest, I didn't even apply again. And medicine is a very big deal. Just getting admission to study medicine is a big deal in any university, private or public. It's a very big deal in Nigeria. And I remember that day I had malaria, and my university was just young, just 3 years old at the time. We had just moved to our permanent site, and we didn't have accommodation on campus. Medical students had accommodation on campus, but for the biochemists, we were all in the same class, 100 level, doing the same course, but medical students had accommodation on campus. We had accommodation off campus.
Right.
So I had malaria, and I was in the hostel. One of my friends, I was in one of my friend's rooms, and he was a medical student. So we were all waiting, because the Senate was going to release the results of those that successfully made it into medicine that day. So we're all waiting anxiously. And I was sick, but I stayed back, to celebrate with my friend. And then when the result was out at around 3 p.m., I woke up, I was like, oh, are the results out? They're like, yeah, and all that. And someone was like, oh, congratulations, we saw your name. I'm like, how? I'm not in medicine. And they were like, yeah, are you not this? I was like, yeah. And then I got a call from a friend, and she was screaming, "Hey, congratulations! We saw it." I was really surprised, but yeah, I was really happy too.
Good. What did you specialize in? Because you practiced for a few years. What is it you actually did?
I was working as a medical officer in the state hospital, but I was also interning under Dr. Ilang, my mentor, who is an orthopedic surgeon. So that's the bulk of the work I was doing before coming here.
Did you get to use those surgeons' hands? Your
Sure. A lot.
What was next for you? Like, what drove you to how did you get into health informatics?
Like I told you, I also work as the program director at Rebecca Mbok Foundation. And, increasingly I began to notice that medical practice as we have it today in Nigeria is not enough, to solve the fundamental problems we have. We need good data. We need good healthcare systems that are digitalized. We need, the right information to the right people at the right time. And that was sorely lacking. It still is. I knew that, to make a significant impact, one would need to do something different. The traditional route for most doctors in Nigeria is, to go into residency training, mostly clinical training, and then become a consultant in a particular field. And I like I told you from the beginning, I don't like doing what most people do, right? So I'm more like a rebel. So that was perfect for me. And the health status of women in Nigeria, especially maternal health, is terrible. It's one of the worst in the world. It's second only to India globally, and it's the worst in the whole of Africa. About 1,047 maternal mortalities per 100,000 live births. That's a lot. The UK, I think in 2022 was just 9.2. In places like Denmark and other Scandinavian countries, 2-3 per 100,000 live births. And we're talking about 1,047 in Nigeria. So you can see that it's a lot. And I can guarantee you that is even underreported. In some parts of Nigeria, it goes as high as 1,200. So, but with health informatics, it's a big game changer, right? It's a big game changer. And that was the major motivation. And I've always had interest in the digital information technology field. Like you heard from my story, I was in computer science at the point, right? Yeah, so I think that part of me was always going to find its way back, into my life. So the perfect blend between medicine and information technology, is health informatics. So it was easy for me to get into that.
If you don't mind me asking, how did the foundation come about? What were the origins of that, and how long has it been running?
The foundation started shortly after we lost my mom. She died during childbirth in 2006. And it was a very devastating time for me and my family. I was the oldest at the time. And I had 3 younger siblings. My immediate younger sister is about 7 years younger than me. So I was 16 at the time.
Right.
So,
yeah.
And it was, one of the worst, experiences of my life. 3 years after, we decided with my dad that, okay, what can we do to make sure that no other family has to go through what we went through? Because you see, when a woman dies, it's not just the family that is affected. Because, look at it. When a woman dies, the children are affected. So you have cases of malnutrition higher in children whose mothers are not alive. And like in medicine, we say children are the barometer of the family, right? It tells you about the general state of the family. When a woman dies, the society itself, the entire community is affected because those children grow up without guidance and all that. So they're the ones out of school. Then you start talking about the social implication of that. And then the economic implication of that. You talk about the emotional aspect, it's a lot. So we felt, look, we need to do something about this because the rates were, off the roof. I can tell you for sure that there's hardly any family that, has not experienced, a maternal death in, some parts of, at least where I'm from, northern Nigeria. I know that almost every family knows someone or has experienced it themselves, one form of cause of maternal mortality or the other. So that's how the foundation came about. And, we started, from our immediate community. And then eventually we collaborated with the American College of Nurses and Midwives, where, we did, we used one of their manuals on what we call home-based life-saving skills, which is a family-focused but community-based method of providing first aid to women shortly after delivery, when they have any form of complication. That is something that the community, the family members can do to enable the woman survive before receiving medical care. Yeah. And well, we've been able to we've had several outreaches. We had several outreaches, so many communities in Plateau State, in Bauchi, Gombe, in so many states in the north. We've also worked with the Federal Ministry of Health at a point in time, where my dad, who is the country director, served as a member of the core technical committee on maternal mortality in Nigeria. Yeah, so the foundation has has grown, and I can tell you for free that the impact has been very, very impressive, because what we do is we go into a community, we meet the key stakeholders in the community, the religious leaders, the traditional leaders, the women leaders. We have a meeting with them. We invite the traditional birth attendants, because strangely, most of the women believe more in the traditional birth attendants than they do in the main Western kind, or rather our own Western kind of hospital medical practice, right? So we can't shove the traditional birth attendants away, because they are the people that those women listen to. So we decided that it's best to collaborate with them. So we educate them and say, look, this woman is pregnant. She has 9 months of being pregnant. Why don't you prepare yourselves? Why don't you put all the necessary steps, right, to make sure that in case of any eventualities, you are well prepared to handle this. So, okay, what is the problem in this community? You don't have good roads, okay? The terrains are terrible, and unmotorable. So how can we solve this? How can you transport this woman to the nearest hospital? We've gotten the community to get involved. So everybody in the community is a stakeholder, in ensuring that this one woman survives. It's a very complex situation. There are some problems that you see, it's poverty, it's social, right? And you may not be able to solve it as a foundation, but you can at least try to educate those people. You have to admit and acknowledge that, look, these are the people that have the say on this. So how do you work with them to make the best out of the situation? You can't just come out of the blues and say, no, this woman has a right to... It's not going to work. They're not even going to listen to you. Yeah, so the challenges vary from, community to community.
Okay. So after doing that for a few years, what inspired you to study health informatics? Like, what inspired you to come to the UK, to Swansea? Like, where did that decision happen?
I was fortunate to know early enough that, to make a big difference, we would definitely need the collaboration of technology. We do not have enough human resources in that regard. And I, for one, have never met any health informatician, digital health specialist, during my stay in Nigeria. Now that I'm here and, I've done some researches, I've been able to liaise with some back home, but I didn't know that they were even there before, coming here. Right. And, for example, I was talking about places that are unmotorable, bad topography, the problem about delays in deciding when a woman should go to the hospital, poorly manned primary healthcare centers. All these things can be solved with technology. And that's where health informatics comes in. But we have over 60,000 primary healthcare centers spread across Nigeria. But the problem is that they are poorly manned. If we can get, enough investment in, digital health, we can leverage on telemedicine, for example.
Right.
And those people at the primary healthcare center can have, some form of supervision remotely by healthcare workers in, secondary and tertiary healthcare facilities, because they are more experienced, they have more training, they are more knowledgeable on the subjects, so they can assist remotely, because a lot of those people in the secondary and tertiary healthcare facilities do not want to go to those remote villages because of so many factors: insecurity, poor social amenities for themselves and for their families. I mean, if you're going there, you need a good school for your children, you need good water source, you need, stable electricity, which are not available in those remote places. So nobody wants to stay there. So, but if you're able to have a way you can link them technologically, it's going to make a big difference. And so why I chose Swansea University, a lot of reasons really. Yeah, but first of all, I saw the caliber of people in the health informatics program in Swansea University. They are highly reputable people, and it's one of my my main reasons. The medical school, rating one of the top 3 in the UK, the SAIL data bank, the secure anonymized information linkage, which houses billions of anonymized linked patient data in the UK. It's one of the largest in the UK, one of the largest in Europe, and it's housed in Swansea University. So I know that I knew from the onset that coming here was going to give me, an all-encompassing experience. I was looking forward to some form of practical, in terms of, getting involved with the data, considering, the number, the volume of data specialists, in the department. Although that particular expectation was not met, but I think my overall expectations were nearly met. Yeah.
So what were your first impressions of Swansea when you first came here? What did you think? Both as a city and a university.
Okay. At the city, I was really impressed, to be honest. I think I was more impressed by the people at first, because I didn't move around much when I first came. Before coming, trying to get my mind into the whole new experience that I was anticipating at the time, I was, reading about, how generally, the idea of individualism and how the society is here. I was a bit worried coming from a society where everybody, seems to be involved in everybody's affair. Yeah. But when I came here, I was really surprised because the people are extremely friendly. And sometimes I was like, what were those people talking about? When I first came, I found people, opening the door and holding it for you, initiating conversations, asking you, how is the weather? I was blown away. It was incredibly awesome. I really loved it. I remember my wife and daughter were yet to join me at the time. I called my wife. I was like, this place is amazing. It's, it's not, the way people have said it to be. But, well, some people later on told me that it's just Swansea and it's just a Welsh thing. It's not like that in England. And when I went to London, trust me, I experienced that. I experienced the difference.
Oh, yeah, it's very different.
Yeah.
Did it take you long to acclimatize like that? Because culturally, it's obviously going to be different. And
Yeah.
You were experiencing that. Did it take you long to settle in?
Yeah, for me, it didn't really take me long to settle in, to be honest. I'm a bit outgoing, but apart from that, the environment felt like home. I come from a place called Plateau State in Nigeria. Our topography is very similar to the one in Swansea and Wales, as a matter of fact. We have a lot of mountains, a lot of green valleys, a lot of, the weather, it's it's the coldest in Nigeria. And, a lot of similarities. Our people are very friendly as well. And we're traditional as well. I think there were a lot of things that I found in common with what I had back home. So it didn't take me long to acclimatize.
What were the biggest challenges?
The biggest challenge for me at first was, I think that challenge was before I got my house, accommodation. I was just squatting with a friend for a week, about 10 days or so. I didn't get to eat Nigerian food. That was, it took me off because at first, for the first 3 days, it was, oh, well, I'll just go to KFC, go buy chicken and chips. But it became a big problem when I saw that was going to continue on. So I intensified my search for a place, because I just couldn't wait to start cooking. But, there are a lot of places where you can get African food here, but I didn't know at the time. So, yeah, that was my major challenge, to be honest, when I first came. Thanks to Chevening, I didn't have to worry so much about, other things.
I'm glad you mentioned Chevening there, actually. What was that process like for you? And like, how did it first come up for you? Like, how did you find out about the Chevening scheme?
I first heard about Chevening from two of my mentors, Dr. Meshach and Dr. Michelia in Jos. They are both Chevening alumni. They mentioned it, passively, like, why don't you consider applying for, Chevening? Like, think you make it. And so I did. My first attempt was in 2020, but I had other things I was doing, and so I didn't finish the application. I didn't complete it. Then I tried again. This time around, I went through the whole application process. It was really tough, to be honest. Everything had to be perfect. Every sentence had to communicate a particular message, because you had just 500 words for each of the 4 essays. So you had to be very economical with your words. So every sentence had to convey an important message that was going to earn you a point, so to say. To the interview process, it was, it was as expected. It was, but very friendly people. Yeah. They asked a lot of questions that, would make sure that the decision to give you the Chevening scholarship is worth it. And it was really interesting for me, because initially I was supposed to do my interview in Abuja, but I happened to be doing my German course in Lagos at the time, so I had to change it. So I was the last person to be interviewed, and I felt, I hope these people haven't, made their selection before, because they told me, well, we'll just leave the last slot for you on the last day, we'll create something for you. So I just went. I was like, well, it appears these people have already picked their candidates. If I'm selected, fine. But, I didn't have much hope, because I felt, since I was the last person to be interviewed and it was just an afterthought for them, perhaps all the slots for Lagos must have been filled. Here we are.
How long did you have to wait before you found out?
About 3 months.
Okay.
That's after the interview. Yeah, I think about 3 months. I'm not sure.
Had you written it off? Like, was it a surprise then when it came through?
One of the people in the panel called me to ask me about my choice of university, because I got admission in other universities as well. So the person called to confirm if Swansea University was my, first choice. During the interview, they asked me, and I told them I wasn't sure. I had 2 choices. So they called me again to ask if I had made my decision about which university. And at that point, I was like, is it possible that these people want to shortlist me for the scholarship?
How did you celebrate? And was your wife pleased as well?
Yeah, she was. At first, I didn't know that I could travel with her. So it was a mixed feeling for both of us, because I didn't want to travel and just leave her and my daughter, who was just 3 months at the time. So it was a mixed feeling, but later on I realized that I could come with them, just that I have to be the one to sponsor them. I was very happy with that. And I'm just imagining if I had not come with them, I would have been so lonely and would have been really tough.
Outside of your immediate family then, have you been able to like build any sort of like networks, any communities outside of your studies then? What have you been able to do?
Made a lot of friends, for sure. I've also been able to, join the church here. Very lovely group of people. And then I've also, I've not been so active in the other group, so I'm not gonna. Yeah.
Do you think you probably would have engaged more if you were here on your own, maybe?
Yeah. So if I was here on my own, I sure would have.
Because I'm just thinking about the students who travel here and they're on their own, and about how beneficial those communities can be then.
Yeah. Those communities are, usually really helpful because like the BMHS, which I joined, they helped a lot of my friends with how, advice on how to get jobs, how to construct their CVs. They even offered some trainings for people, for different roles, and then helped connect them with employers. They also organized a lot of events for them. And, not just for them. I mean, they have a lot of events that they organize in those societies, which is a good avenue to, make friends, to learn about, new things.
What's your favorite thing about Swansea been? Is it the people, or is there anything else you've enjoyed during your time here?
Swansea, a lot of things. If I had my way, I'd never leave Swansea. Right? Where do I start from? Okay. I love the people. The people are really amazing, to be honest. I love the topography, the environment. I've been to Mumbles, I've been to those Welsh names, a little bit difficult to pronounce, but some of those mountains.
Right, yeah.
There's one, I can't remember the name. Yeah, but I've been to a number of them. I've been to a few sites in Cardiff as well. But in Swansea, I've been to quite a number. I just can't pronounce the names, the Welsh names, right? Everything about Swansea is really lovely for me. I was at the air show.
Oh
yeah, recently, and I was blown away. And I know there are a lot of activities like this, all through the year in Swansea. So there's always something to do. There's always something to keep you going, something to look forward to. Welsh food, I love it. It's really amazing. I love the sandwiches. I think the one that kind of didn't meet my expectation is the Welsh cake. It's a Welsh cake. I had these high expectations. Yeah, but every other thing,
You're working on towards finishing your course now. You're working on dissertation.
Yeah.
What's next for you? What's coming for you after you finish up here?
Oh well, I'd have to go back to Nigeria. I intend to use a lot of things that I've learned here, digital health, to help set up the digital department in my hospital where I was working, Plateau State Specialist Hospital, to help, I know that the management is trying to develop the electronic health records, and I know I'm going to be very, very helpful in that, because I've learned a lot about what best to do. And yeah, so that would be my immediate plan. I also intend to help a lot of young people, see the prospects in digital health and how they can key into it. I also plan to see how we can start developing, our digital department in Rebecca Mbok Foundation, to see how we can get the right funding, to see how we can, build this infrastructure, to see how best, we can reach out to people and help with the major challenges, especially regarding maternal and child health. I also plan to liaise with, government bodies, other NGOs, to see how, we can build digital infrastructure. We are suffering from what I term data isolation epidemic, right? Where we have a lot of isolated data, which, isn't helpful to anybody, right? But if we can find a way to harness this data, then we can say, we have big data that we can, use for different aspects of, healthcare. It's something that I'm working on, which is also something I'm working on with my dissertation, interoperability. And so hopefully I will be working on these things.
Last question for you. What advice would you give to someone who's considering coming to study here in the UK? Not necessarily just in Swansea. If they're thinking about leaving their home country, they're thinking about coming to the UK, what advice would you give them?
Firstly, I would say keep an open mind. If you're leaving home, you should know that you're coming to a new place. So your mind should be open to learn as you go, and don't come with high expectations that things are going to be the way you want them to be simply because you want them to be that way. Come with an open mind that, look, I'm going to keep adjusting as things unfold. And then also, come with the mindset that you're going to embrace the culture. Of course, you're going to sieve out the part of the culture that you do not find to be, in line with your personal or your moral beliefs, whatsoever it is. But, don't come with the mindset that this culture is this and this is because you don't know yet. So come with an open mind and say, look, I'm going to learn this culture and see the part of the culture that I'm going to embrace and the part I'm going to keep aside.
Wonderful.
Yeah.
Thank you. Thank you for everything you've shared with us today, Nenkang. That's really good. If you've enjoyed this episode and want to find out more about studying in the UK or want to listen to other episodes in this series, please visit our website, swansea.ac.uk/international.